Which one is? That one. Okay. Good. All right, good evening, everybody. Can everybody hear me? Happy Earth Day. So tonight I picked a rather broad topic on treating the heart and high blood pressure and various arrhythmias. So we're going to talk about that tonight. Chances are at least half of us are dealing with high blood pressure, so it's really a big deal. And one thing I want you to leave with tonight is knowing that high blood pressure is more of a symptom rather than a disease. So you often hear about, especially from other doctors, conventional doctors, that high blood pressure is something to really go after and treat and take this medication, and there's a zillion drugs out there for it. But we're going to go over what's behind it, what's causing it, how you can deal with it. It's something that's very, very treatable with natural remedies. Let's see if my clicker works. So I start all my talks off with just a little brief explanation on how I approach medicine. So my approach is more of a functional medical approach rather than trying to just give you something that will treat asthma or high blood pressure or, whatever it is, a skin rash. It's very easy to put something on a skin rash and make it go away, but have you really treated the cause? Sometimes skin rashes can be related to digestive problems or even some genetic issues. So what I like to do is look at the functional problem behind it, try to balance out the digestive tract. One thing I look at is balancing the acid-alkaline levels in the tissues. And a lot of times just doing that can create immediate recovery for a lot of different problems. I try to promote just a natural detoxification process, and it's not something you have to do every spring for 2 weeks, go on a fast or something. Body doesn't work that way. It's much easier to do it on a daily basis and encourage your body to eliminate properly. And by eliminate, I mean not only the colon, but your lungs, your lymphatic system, your skin, all the organs of elimination, the liver and kidney. You want to make sure all those are eliminating efficiently. And of course, anything to promote circulation, exercise is excellent for that. Optimal hormone levels will keep us functioning really well, keep us healthy. Another thing I look at is balancing the anabolic and catabolic process. So, and actually our 24-hour day is based on an anabolic and a catabolic time frame. So initially when we wake up in the morning, say between 4 a.m. and 4 p.m., we're much more catabolic. We're much more active. We're breaking down nutrients that we acquired maybe the day before. So we're using up, we're really active at that time. Whereas at 4 p.m. to 4 a.m., we're much more anabolic. We're more quiet, we're resting. We tend to eat more late in the afternoon or evening. And we, that's all right. And of course, we sleep through the night, which is very anabolic and provides us the nutrients that we've collected through the day in our food. And of course, we want to treat any nutrient deficiencies, and sometimes the timing of treatments makes a big deal as to whether it's going to work or not. So let's say you're trying to rebuild the adrenal glands. Of course, the adrenal glands operate, their peak operation is around 8 a.m. So you want to give most of your adrenal function at that time, adrenal support at that time. So let's talk about our hearts. And I think we take our hearts for granted. You know, when you really add up what the heart does, it's a pretty amazing organ. The average heart beats an average 103 times per day, 103,000 times per day. And that adds up to like 3.1 billion times in a lifetime. And we rely on that, you know. We try to extend it as much as possible. Now, one thing I tell my patients is if you invest in exercise, you can actually have a resting heart rate that is much longer. Okay, so you may go down to 50 or 55 beats a minute, even though you're investing, you know, a really high rapid heart rate while you're exercising. So your net heart rate goes way, way down. And I heard a cardiologist one time say, we all have the same number of heartbeats. It's just how we want to invest it. You know, we can't invest it in, you know, being overweight or not exercising and having heart problems. And so, yeah, that made sense to me. The average heart pumps 2.4 ounces of blood per heartbeat, and that results in 1.3 gallons per minute, 1,800 gallons per day, and over 56 million gallons per lifetime. So I don't know what that all means, but it sounds good. So this was an interesting find. The heart actually replaces itself. So we think of the heart as basically something that's just kind of there. It's a muscle. It's, you know, it's always functioning and pumping. But actually, it replaces about 50% of the muscle through our lifetime. So, which is good news because we can provide the right nutrients to help rebuild that heart. So there's always a chance, you know, there's always time that we can repair it. The turnover rate for heart muscles are actually much quicker the younger we are. And then the turnover rate kind of slows down as we age. So initially, I just want to talk briefly about the real causes of heart problems. So this is aside from high blood pressure and arrhythmias. We're going to talk in depth about that, but I do want to talk about what the true causes of heart disease is. And I would recommend that you, there's a great book out by Stephen Sinatra called Metabolic Cardiology. And I heard him speak one time and he really inspired me, but he talks about heart disease being a mitochondrial disease. And what is that? The mitochondria is the part of the cell that makes ATP, which is the energy molecule of the body. So whenever we do activity, we make ATP to help our cells function and, you know, basically work. So whenever you have heart problems, there's usually a lack of that ATP in a certain part of the heart or certain areas that make it dysfunction. Okay, so we're talking more on a cellular basis here. Here's a quote from Dr. Ingwell, professor of physiology, physiological medicine at Harvard. And she talks about myocytes needing ATP to maintain normal heart rate, pump blood, support increased workload. The myocyte needs ATP to grow, to repair, and to survive. The requirement for ATP is absolute. Okay, so when we think about taking care of our hearts, we're actually using our hearts. We're using the pumping ability. We're maintaining circulation through the heart, and we're also maintaining this ATP. So, no. Question was, can we measure the ATP? Not really, but I'm going to describe it more in a second. what is ATP? ATP is adenosine triphosphate, okay? And it's actually the basis of most of our body's function. So the human body turns over its own weight equivalent to ATP every day. So that's a lot of energy produced. And one thing to remember too, that ATP is pH dependent. So what does that mean? pH represents either acid or alkaline, and our body maintains a certain level of pH to really function at its peak. And what they've shown is that ATP actually breaks down the more acidic you become or the more alkaline you become. So the investment in maintaining a good pH, a good healthy pH, will maintain your heart just like many other organs. You know, and a lot of you have already heard me talk a lot about acid-alkaline balance, but I really think it's a big deal, and even with the heart function, it's a big deal. So energy is released from the transformation of ATP to ADP in the cell mitochondria. So I apologize for getting into a little biochemistry here, but I think it's important. The heart ATP is recycled 10,000 times a day. So the good news is we can recycle this ATP. So how do we keep building that ATP? How do we keep it going? And most of the heart diseases that we know are really linked to this ATP problem. So that includes angina, which is basically a poor blood flow through the heart muscle, congestive heart failure, mitral valve prolapse, ischemic heart disease, which means limited blood flow through the heart, and this ischemic heart disease, which is basically heart disease, coronary artery disease, is related to high blood pressure and also is linked to 40% increased rate of ATP breakdown. So it's really an important issue, and by taking care of this, I think you can take care of a lot of different things and prevent a lot of problems. So these are the things that I recommend to help maintain your ATP. And the good news is this also helps maintain your muscles and a lot of other cellular function. But CoQ10, of course, is one of the most potent food for the mitochondria within the cell. So the cell is much more able to make ATP at that point. Carnitine, D-ribose, magnesium, hawthorn. And if you're familiar with these things, we often hear about these particular supplements in treating the heart. And it turns out that these 5 things will treat many conditions, many heart problems and this is usually where I start. Dr. Sinatra talks about the top 3 there as the triad of metabolic cardiology. So, and especially if you have heart disease in your family, I would think about doing those top 3 especially. Yeah?
Yeah, I thought I might drink maca and but it helps increasing ATP. And also, I was wondering, is that L-carnitine?
That is L-carnitine, yeah. So the question was, is maca and rhodiola linked to ATP production? I haven't read that, but it's very possible. And one thing to remember, we're not talking about caffeine. We're not trying to push anything. We're just talking about feeding the cell energy production to help your heart repair and function better. The hawthorn extract is something that seems to be nutrition for the heart. There's a lot of bioflavonoids in there. So it acts more as a nutrient. Any questions about all that? I know it's a little confusing.
Is it also helpful to the arteries as well?
Those ingredients are helpful. Yeah, they are helpful to a lot of different tissues. We're going to talk about circulation now, so that it might make more sense.
I thought I heard evening primrose too.
Evening primrose oil can be helpful, sure. So what is high blood pressure? There's a lot of different causes, and we're going to go through them, but blood pressure is basically when the heart contracts, it pushes pressure against the vessels. So it kind of expands, you know, and in between heart contractions, the heart vessel or the blood vessels contract and relax, okay? So those are the two numbers that you're getting. Systolic means when the heart pumps, that's the top number, that's the higher number on your blood pressure reading. And the diastolic is the lower number, you know, in between pumps. So the heart is relaxed at that point. Does everybody take their blood pressure at home? Everybody has a cuff? Yeah, good. Yeah, it's pretty easy. The normal blood pressure is around 110 to 130, over 75 to 85. And I actually like to see a big difference between the top number and the bottom number. And I think I disagree with some cardiologists on this, but my thinking is if you have a wide variance between the low and the high number, you know, that means there's more expansion going on. There's more flexibility. Okay. So high blood pressure is considered anything over 140 over 90. Up to age 60, this is a new thing. Hope it's not for me. And then once you get over age 60, then they're giving us the approval of we can have a blood pressure of 150 over 90 once we reach the age of 60. So this is actually good news, which I'll mention a little more in a minute. Now I wanted to show this picture. This is the inside of a blood vessel. Okay, so I want you to kind of picture that. These red blood cells are just moving through as the heart pumps. And every one of those red blood cells are loaded with oxygen, right? They're carrying oxygen to the various tissues. So, so depending on what else is in that vessel along with the red blood cell, you know, there could be, you know, let's say you have an infection, there could be a whole bunch of white blood cells in there. Or let's say you have heavy metals, there could be lead and mercury in there. Or the lead and mercury could be contained in the red blood cells. But every one of those red blood cells should be carrying the mitochondria, which have the ATP, that are being delivered to various parts of the body, okay?
In that picture, are any of them platelets?
Well, you can't see them, but they're there, yeah. And we're going to talk about blood viscosity a little bit in a second. So this was actually really good news. The American College of Cardiology just a month ago recommended to raise the normal range for adults for blood pressure for adults over 60 to 150 over 90, up from 140 over 90. And I know a lot of patients come in, they go, oh, my doctor wants my blood pressure under, you know, 120 over 80, you know, 110, 70 is the ideal, and he keeps adding more and more medication. So I think they've really backed off on that. But just just raising that one number for people over 60 is going to be reducing the number of adults by, what, 9%. Right now, 41% of adults are taking medication for high blood pressure, and it just doesn't have to be. But this one act will drop the medication down to 32%. And there's definitely ways we can lower it more. So let's talk about the different types of high blood pressure. And a lot of you may be aware there's something called essential hypertension, which means they don't know what the heck is causing it. And it adds up to 90 to 95% of high blood pressure. And there's secondary high blood pressure, which represents about 5 to 10%. And these are known conditions that are much more rare, things like kidney disease, high stress hormones, arteriosclerosis, blocking of the vessels, in other words. But by far, the vast majority of high blood pressure is called essential. So basically, the doctor will just give the person a medication because they don't know what the heck is causing it, and they don't want to pursue what the reason is. They don't want to pursue or find out what the reason is. Or they might say, oh, reduce your stress. What does that mean?
Is there a difference between hypertension and high blood pressure?
No.
Oh.
Hypertension is high blood pressure. Yeah. Same thing. So hypertension, high blood pressure is a symptom, and there's two ways to approach it. You can do a metabolic therapy, which tends to regulate the underlying physiological process. So you can either upregulate or downregulate based on your own physiology. And this is very simple to do, and you can play with it and monitor yourself and deal with it. And you can do this using foods, nutrients, even water. Adequate water can help your blood pressure. And of course, these are much gentler and have less side effects. But when you go to the drug therapy, these tend to block the natural physiologic function. So for whatever reason, your heart is pumping harder, trying to get blood flow through the body. It's having difficulty, so it pumps harder. So rather than trying to deal with the original cause, the conventional medicine will provide some kind of block. So that's why we have names like beta blockers or calcium channel blockers or ACE inhibitors. These are all things that intervene and stop the normal functioning process. So when we do that, of course, we're going to have more side effects, right? The body wasn't designed to be blocked like that. So there's much more side effects with that. Which would you rather do? So just briefly here, blood pressure is basically a function of how hard the heart is pumping out, and then also how much resistance it's pumping against. Okay, so the more well, let's talk about heart output. And that's a function of how much blood is being pumped out by the heart, along with how quickly it's pumping. So one thing that happens with the heart rate is if it's pumping really fast, it's not going to be as efficient at getting blood through. So there's various signals within the body saying, okay, we need more blood. The heart has to pump harder to get get the blood through. And then we talk about peripheral resistance. So the blood vessels in the rest of our body out surrounding the heart also provide some kind of resistance. So the less exercise you do, the less capillary filling that you have in some of those smaller vessels throughout your body. Okay, so that's why exercise is such a big deal. And then also it's a function of how stretchy those vessels are, how they expand, or are they just lead pipes? If you take a person's blood pressure and it's like 120 over 120, what does that mean? It's like a lead pipe. There's no expansion there. That's a problem. So, we link high blood pressure to all these various problems: heart attack, stroke, kidney disease, peripheral vascular disease, which is basically arteriosclerosis. And that's, the fear is, okay, we have to drop your blood pressure to prevent these problems, okay? But again, we're going to look at why your blood pressure goes up. Why is that happening? What's behind it? High blood pressure can cause all these different issues. In the brain, of course, it can cause a stroke, either hemorrhagic or blockages. It can cause just changes with brain function, confusion, headache, even seizures. It can affect the eye. There's a link between high blood pressure and blood sugar also that we're going to go into. And of course, the heart has its own circulation. It's not just a pump. It needs nutrients also. So you've got blood vessels going all through the heart to provide that muscle with enriched, oxygenated blood also. And the kidneys are one of the most sensitive organs to blood pressure. So it actually has hormones that it pumps out to either lower or raise blood pressure in response to your circulation. So here are the top 5 causes of essential hypertension. So, and these are things that may seem obvious, but the literature really supports these things in a lot of different studies that we'll go through, but these are really simple things that will drop your blood pressure quickly. And I'll show you how much and why. Now we all hear about salt. Okay, what's the deal with salt? Turns out that salt is a cause of high blood pressure up to 30 to 50% of people with high blood pressure. Okay, and as we learn more about salt, it's not so much the salt itself. You don't necessarily have to go on an extremely low salt diet. It's the imbalance between sodium chloride and other minerals. So you want to keep track of your potassium and magnesium and calcium and other trace minerals, because if your body doesn't have those, it's going to use the salt in those biochemical pathways. Okay? Does that make sense? So salt restriction can cause fatigue, insulin resistance, and even postural hypotension, which is getting dizzy when you stand up too quickly. So your blood pressure drops suddenly when you stand up, and you feel kind of woozy, you're not getting enough blood to the brain. And sometimes that can be from salt restriction. So 1 teaspoon there is 2,300 milligrams of salt. And that's considered a moderate salt restriction. The average American eats about 3,500 milligrams of salt per day, about half a tablespoon. So Dr. Wright, in his brilliance, came up with this Wright salt that you can purchase in our dispensary, but he was basing it on this one study in Finland where they between 1972 and 1992, they measured, or they switched the whole population to this sodium-reduced potassium, magnesium, and lysine blend. And everyone used it. That's the advantage of socialized medicine in Finland. They can do something like this across the board, both industry and home. And the results were astounding. An average 10 millimeters drop in the diastolic blood pressure. For some reason, they didn't post the systolic blood pressure, but I know that dropped also. They had a 60% decrease in death from stroke and heart disease. 60%. So despite the fact that there were increases in alcohol intake over that 20-year period, there was more obesity among men, smoking among women. They actually adhered to some of the dietary recommendations, which include, reducing saturated fat. But everyone used that Wright salt, and it was pretty astounding. So why is salt a big deal? What happens is salt tends to live, right outside the cell. Okay, let's pretend this is just an average cell in our body, and we've got trillions, right? So right outside the cell is the serum and the extracellular fluid, it's called, or outside the cell, and that's where the sodium lives. Excuse me. So the more salt you take in, the body says, oh, we have to balance that salt. We have to add more water to that area. Okay, so it pulls moisture out of the cell, and with that, other minerals that occur inside the cell. Having a voice lapse here. And that's why if you get too much salt, you can get ankle swelling. Has anyone had that? And that's also why, notice the little mitochondria here where your ATP is formed. But magnesium, of course, lives inside the cell. So without the magnesium, you don't get the fluid back into the cell to maintain the normal cellular function. Okay. So that's what's happening on all of our cells over and over again, back and forth. And that's why salt can be such a big deal with blood pressure. Does that make sense for everybody? Okay. How do you get the moisture back in? You do by enriching the cell minerals, and that will draw the fluid back in. Okay. The Wright salt is actually better than sea salt. Sea salt is about 75, 80% sodium chloride anyway. So you want these other minerals, And you don't necessarily have to use the Wright salt to get those minerals, but you do need the minerals. You might juice, or you might have, soup broth, But you have to get those minerals somewhere. And vegetables are probably the easiest source for that. Okay. One test that we can do here at the clinic is something called the BIA assessment, or bioelectrical impedance analysis. So we hook you up to a little machine. We just put a little patch on your hand and on your ankle, and it measures your body composition. And it's kind of cool because it'll actually tell you your intracellular fluid and your extracellular fluid. So the people that are really healthy and really have a lot of energy, and they tend to have a much higher level of intracellular fluid because that's where they're making their energy. And you can actually measure it with this machine. The more toxins you're dealing with, the sicker you are, the more your extracellular fluid goes up because your body's trying to get rid of some of the toxicity, okay? So it's one of those things that you can actually monitor a person's improvement or, see if they're getting worse. Here's, I know what I wanted to tell you. So obviously I'm really into minerals, and I like to see why are they important, what they're doing. And there was an old doctor that taught me this a long time ago, but he used the periodic chart in a way that most doctors and most nutritionists don't. And he taught me that various rows correspond to various compartments within the body. For example, sodium, we know most of the sodium in the body lies right outside the cells, in the serum. But the farther down we go in the layers, the deeper these minerals tend to reside. So the next row down, we get into the intracellular matrix, and then we get into the nucleus of the cell and the subnucleus. So it's really fascinating. And that's why, things like lead, mercury, are really hard to get rid of because they deposit really deep within the body, sometimes in the nucleus of the cell. Those molecules, really hard to get out, hard to chelate out. And that's, again, why we need those trace minerals, even the really small trace minerals, not necessarily just magnesium or calcium or iron, but we need the boron and the chromium and manganese. And we need them in really tiny quantities, but we need them. Really important. So there are a lot of studies showing heavy metals cause high blood pressure. Most of the research I found was with lead and cadmium. Lead definitely corresponds to increased systolic and diastolic readings. And a 1992 study found that 130 cities, including Seattle, had higher than 15 parts per billion in the water, which seemed to be enough to, stimulate the mayors of all these cities to really work on this. So, Seattle now claims to have 0 lead in the water. Cadmium is another big deal, and there's simple ways of measuring these metals in your body, and I don't think we'll talk about that tonight, but there's a good way to do that. And cadmium is one of those things that we get from secondhand smoke. It's probably the biggest source. So, And even growing up, I found that patients that had parents who smoked, that cadmium is still there. It's really hard to get rid of. But it's also in water pipes, metal and plastic, fertilizers. You know, and of course my patients come in and they say, where did all this come from? And it's really hard to know because we're just all exposed to it. It's just everywhere. Yeah.
Is there a concern with radioactive cadmium or any other radioactive particles that may be coming our way?
Yeah, I mean, the question was, is there a danger of radioactive material showing up? And definitely there is. Uranium is checked in the standard tests that we do here. So, yeah. And my thinking is it's not just lead and cadmium, although that's where most of the research is right now. You know, it's likely all the different heavy metals. I find a lot of aluminum and arsenic in people. So these metals, when they're there, are taking the place of the essential minerals. So your body is using arsenic instead of magnesium, let's say, or lead instead of calcium. Now, another thing that influences our blood pressure is how thick our blood is. And which another term is just called blood viscosity. Okay, so in other words, water will have a really low viscosity, and honey, something like honey, will have very thick viscosity. Now, something that happens with men who are taking testosterone, testosterone, of course, is very anabolic. So what is anabolic? It builds up our system. And it especially increases the red blood cell count, which is measured by the hematocrit. And the hematocrit is like the percentage of red blood cells in the blood as a fluid. Okay? So if you separate the cells from the liquid in a sample of blood, you know, for a guy it's usually like 45 to 50%. And for women it's about 42 to 45%. Okay. You know, HDL, cholesterol, and donating blood are about the only things that are known to drastically decrease blood viscosity. And there was one research study, which I don't have up, showed that men that donated blood had 80% less mortality than men that didn't. And I think that's because they're gradually just reintroducing new red blood cells and rotating the old ones. Excuse me. Come right in. You want to come right over here?
Now, Dr. Sherman, when you say that HDL cholesterol should raise that to help the thickness of the blood and or donating blood, so then one would have to take something to help raise the HDL, either exercise or something.
Right. So anything that will raise HDL will help lower blood viscosity.
How often do you guys recommend donating blood?
How often to recommend donating blood? I would say 3 to 4 times a year. Yeah. And remember that the average lifespan of a red blood cell is about 4 months, 3 to 4 months. So that's why a lot of transitions, when you're getting off medication or you're trying to rebuild your bloodstream for whatever reason, takes a good 3 to 4 months because that's why, that's the life of a red blood cell.
So how much do you donate? I heard half a pint a month, or 1 pint every 2 months.
Oh, that's a good question. How much should we donate? We can actually figure that out in the lab by measuring your blood viscosity. We can see, exactly how viscous it is, both during the systolic beat and the diastolic beat. Okay, so picture your heart pumping blood out through the vessels. The movement of the blood through the vessels is very quick, right, during the systolic reading. So the viscosity isn't very much because it's moving really fast. But in between, when the heart rate is at rest, the viscosity goes way up. So that's the danger, okay? After salt comes vitamin D is probably one of the most critical things for high blood pressure. And this, I don't think, is very well known. This study showed that a group of 2,700 people with various levels of vitamin D in their bloodstream, it seemed to correspond directly with their blood pressure readings. So it was really interesting. So if your blood pressure or your vitamin D serum levels were below 15, your risk of blood pressure being high is over 50%. And most of us are trying to keep our vitamin D levels, over 60. Probably 60 to 80 would be ideal. So given that graph, your blood pressure risk would be really low at that point. But really fascinating that almost everyone, if your serum levels for vitamin D were between 30 to 39, which is considered borderline deficient, it still dropped your risk of high blood pressure by half compared to the regular population. Does it matter if you take D2 or D3? Yes, I would only take D3 as a supplement, yeah.
There's a couple of different kinds of tests. One's more sensitive for absorption.
Right. There are two main tests to check for vitamin D. There's one called the 25-hydroxy, which I feel is more accurate. It's more stable through the day. It's easier to monitor for people. And there's also a 1,25 that kind of fluctuates quite a bit, but it is actually a little more accurate in the moment. Okay. Here's another really interesting study. And so they took a large number of people, I forget how many, but they compared how people survived just based on their vitamin D levels. And look at the survival rate there. So if you kept your vitamin D over 30 on the blood test, which isn't that hard, most of us can do that with 5,000 units a day. Your risk of dying is only 10% over 10 years. Compared to people that have vitamin D under 10, your risk is down to like 75% in 4 years. In other words, your risk is drastically increased just based on this vitamin D level. And we're not going to talk about metabolic syndrome in particular, but high blood pressure is part of metabolic syndrome. You combine that with high triglycerides, abdominal weight, and one more.
Is it insulin?
Insulin resistance, thank you. Yeah. So vitamin D deficiency has not only been associated with hypertension, but also many metabolic diseases, heart disease, osteoporosis, cancer, autoimmune problems, infectious disease, type 1 and type 2 diabetes. And I like to tell people, you know, vitamin D isn't really a vitamin, it's a hormone. It's an essential hormone that we all need. So what about insulin resistance and high blood pressure? This is really interesting because this shows how much type 2 diabetes and high blood pressure are linked. And a lot of people with blood sugar problems will have also high blood pressure. And of course they occur together in metabolic syndrome along with abdominal fat and high triglycerides. But 80% of type 2 diabetics have high blood pressure. So many people with type 2 diabetes are on medication for their blood pressure. And if we could just keep their blood sugar managed more efficiently, their blood pressure tends to go down. This was an interesting African study, 35 adults with high blood pressure and 35 with normal blood pressure. And they found that the blood pressure and body mass index, the BMI, was directly significant predictor of insulin resistance. So this was kind of nice because Nigerians aren't exposed to all the, you know, the bad food and the garbage that we are. And it's interesting, I heard of another study where they found that Nigeria had the lowest blood pressure on the planet. And I thought that was interesting because here in America, we usually see African Americans as having the highest blood pressure. You know, they have, a lot of them are on medication. But it turns out it's not a racial thing, it's more of a dietary thing. You know, it's all these things that we're lacking, the minerals, the vitamin D, the blood sugar problems.
Aren't there a lot of runners over there too?
I think you're thinking of another country.
Oh.
Where are all the runners? Uganda? No.
Ethiopia.
Kenya, that's it. Ethiopia too, yeah. So another cause of high blood pressure you may not be aware of is cytomegalovirus. And so it obviously doesn't get tested very much, and you know, especially with conventional docs. But every once in a while I'll hear a patient say, oh, I never got better after that flu I had or that infection I had. You know, my blood pressure went up, and the virus seems to stimulate inflammatory changes within the blood vessel, which causes arteriosclerosis and more plaquing. So when you get more plaquing, there's more resistance for your heart to pump the blood through, and that raises your blood pressure. Okay.
Is there a test for that?
Is there a test for arteriosclerosis?
For what that virus
Oh, there is a test for cytomegalovirus. Yeah, you can. You can test if you've had recent antibodies produced or if you developed a resistance to it in the past, and so yeah, that is something we can test. This is really fascinating. If you go to this website, and I'm only going to mention it here because it's not part of high blood pressure, but this is something I'm really looking into in ways to reduce plaquing without doing a lot of chelation or a lot of surgery. I mean, how many people get bypass surgery, or you have to clean out your carotids or leg blockages. It's really a big deal, but this particular product that's offered by the nanobiotechpharma.com people, they're showing an average coronary calcium score reduction of 58%, which I think is phenomenal. And I'm starting to experiment with this with some patients. The graph shows one particular patient who, over a 1-year period, had 100% regression of their plaquing within the heart. Phenomenal. That helps the average. So is everyone familiar with the heart scan calcium score? It's a really simple way of determining how much blockage you have over the heart. So it looks at the 5 main vessels surrounding the heart, and because calcium gets deposited within the plaque fairly evenly for all of us, they can take this calcium score and say, oh, you've got this much blockage, or this is how you compare to other people your age. Okay, so this particular gentleman, 68-year-old, his calcium score was 1928, which is really, really high. So he had a major blockages there. And the vessels can be different, that's the cumulative score. But within, 4 months, he dropped it in half almost with this one product. So when you look at the ingredients, it's basically really natural things. So I can't give you all the ingredients, but like I say, I'm pretty excited about it, and I think it could be a real easy way to not have to do chelation and or surgery. So.
Does it remove other toxins from the body?
I think it works more not in removing toxins, but in dealing with the immune system and why the immune system deals. In other words, the viruses and the nanobacteria, they're called, cause the inflammatory changes within the vessels. And that's what causes the plaque to really deposit. Because what's happening with plaquing? Our bodies create this inflammation within the vessel, and it might just be a little patch within the vessel, just in that little layer below the surface. And then a virus comes in, okay, and our body says, oh, we gotta patch this over, let's bring some cholesterol, and that'll even it all out, okay? And that's what our bodies do. The cholesterol is just the Band-Aid. It's the fire truck at the scene of the fire, but it's getting blamed for the fire, okay? Yeah.
Nanobacteria versus bacteria.
Oh, thank you. Yeah. So nanobacteria are about the size of 1,000th of a bacteria. So that's why they're really tricky. They don't create a fever. They don't create a boil. Your immune system doesn't get challenged in the same way with these little guys. So it's really fascinating research, and I think down the road it's going to be a very big deal in dealing with heart disease.
Can I ask you a quick question?
Yes.
Sorry to hear, I was going to wait till later, but would turmeric help in the reduction of inflammation in that case?
Well, would turmeric or any other anti-inflammatory would help? Yeah. Yeah. So in other words, anything that's going to improve circulation, help your immune system, any kind of reduction in total inflammation, which now we can measure using CRP as a blood parameter, something called C-reactive protein. We can actually measure how much inflammation is in your body So if we can reduce that, then your chances are much better. But turmeric is one of my favorite anti-inflammatories. Yeah. Some other causes of high blood pressure. Let's go through these one by one. We're going to talk about broken heart syndrome. So amazingly, this was sort of a meta-analysis, which is a bunch of separate analyses and studies put together. And they found that even taking 500 milligrams of vitamin C per day over 8 weeks will drop your blood pressure. Not in a big way, but 5 drops on, or 5 points on the systolic and close to 2 points on the diastolic. So not too bad. I mean, and that's easy. We can all take 500 milligrams. I usually recommend at least 1 or 2 grams a day. How about sugar? So rats were tested and fed a high sucrose diet, and they immediately developed high blood pressure, increasing their systolic rate about 10 to 30 points. And what was so interesting is they only increased their sugar intake, or in other words, they only provided 10% of their diet was in the form of sucrose. Whereas the average American is about 20% of their calories is sugar. I know, I saw that number, 20%, it can't be. But obviously this can be a major cause of high blood pressure. And another study that where the rats were also fed a lot of sugar. I don't know what rats volunteer for this. But they were given a niacin-bound chromium, which of course we all know chromium helps metabolize your blood sugar. It actually helps lower it when it's too high and bring it up when it's too low. So it's nice to have in our system. I wondered if the niacin part of that supplement might have also influenced the blood pressure, but it seemed to work pretty well. This was a really interesting study too, just looking at food sensitivities. And it's a rather old study in 1959, but I thought it was still pertinent because we often see this. And this particular clinic found out of 100 patients, 93% normalized their blood pressure just by taking away their food sensitivities. 93%. So obviously food allergies are again another source of inflammation, congestion, and it immediately creates an inflammatory response.
Would there be a metabolic process perhaps involved in that too?
Could there be a metabolic process involved? I think it's more the inflammatory reaction. So, yeah. But when you're eating your food sensitivities, you tend to retain more fluids. There's more inflammatory water collected. You may carry a lot more water weight. Your extracellular fluid goes up. That kind of thing. So how do we know if stress is causing high blood pressure? We hear that stress is really a big deal. Keep your stress low, your blood pressure will go down. So one way you can do that is by taking your blood pressure first thing in the morning. As soon as you wake up, you've been relaxed all night, you just got up, there's no stress basically, right? Unless the alarm just went off. But take it for a month and see what you average. If your blood pressure is normal at that time, then it probably is stress. But in other words, if your blood pressure averages high as soon as you get up in the morning, it's not stress, it's something else. Yeah.
Are you talking taking it while you're still in bed?
Yeah.
Waking up or get up?
Yeah, you take your blood pressure while still in bed. Yeah, I mean, you don't have to have the cuff on your arm already, but keep it close by, yeah.
What's your baseline temperature?
Yeah, same way. When you're checking your basal body temperature, you want to do that without getting out of bed, definitely. The second best time to take your blood pressure is just before bed. So, your melatonin is kicked in, you're pretty relaxed, you're looking at the end of the day, no worries. That's another good time if you don't want to bother with it in the morning. And even if you're taking your blood pressure in the middle of the day, you want to make sure you stay seated for a good 10 minutes before you take your blood pressure. Otherwise, it's still going to be up and down. Obviously, you want to avoid those big stressors. I like the kid with the bag over there. Sure. Yeah, thanks for coming. There's also something called broken heart syndrome. Has anyone heard of this? It's something that we as clinicians we often see this, but I didn't realize it was an actual syndrome. But it tends to occur in women postmenopausal, age 58 to 75, and they actually named it in Japan. They called it Takotsubo cardiomyopathy, or broken heart syndrome. So it's a temporary heart disease problem caused by direct emotional stress. So, and there's no ischemia, there's no blockage, there's no arteriosclerosis. So it's pure emotional stress, either from the death of a loved one or a breakup or some form of anxiety. So what about coffee? We often hear, okay, coffee, you got to get off your coffee to lower your blood pressure. It's a major problem. So this was a study. I thought this was amazing. They gave people 5 cups of coffee a day. I mean, who can drink that much coffee? There you go. And it only, on average, over 8 weeks, it only increased the systolic by 2 points and the diastolic by 1 point. So I think, coffee is kind of overrated or overblamed for high blood pressure. Now, I know it's linked more to arrhythmias, but as far as high blood pressure, it doesn't seem to be a major deal. I would never recommend 5 cups a day, but it's... You're right. Okay, and what exercise should we do to lower our blood pressure? You have a choice of endurance training, so you can go jogging and, a nice gentle jog, or bounce on your rebounder. You can do some dynamic resistance, which is, considered movement, lifting weights, doing something like that. Or you can do isometrics. Does everybody know what isometrics are? It's like resistance against something that's not movable. Okay, so, I'll pretend to lift this table. It's providing resistance, and I'm exercising my muscles, but it's not moving anything. That seems to be the best at lowering blood pressure. And you can do that pretty much anywhere. You know, you can push against the door jambs. You know, you can push against the wall with your legs.
I used to do that in class all the time, and I thought it was just a nervous tick.
But I mean, you can see just with that exercise, you can drop the systolic 11 points and the diastolic, 6 or 7 points. Not bad. We're talking real drop here. And this was from the Journal of the American Heart Association, so it must be real. So these are, well, I'll say these are the top 10 supplements recommended by Dr. Gaby, who, I don't know if you folks know Dr. Gaby. He's a good friend of Dr. Wright. They do a lot of lecturing together, and if you ever have a chance to see them in action, it's pretty funny. And they sing songs together, and it's wild. But Dr. Gaby is a medical doctor, and he is very holistic and does a lot of research, and he came out with this incredible book called Nutritional Medicine, and it's a huge, thick volume. It's very expensive, but he gave these top 10 supplements for high blood pressure. So these are the things that he gives all his patients, which are very similar to what we've been going through tonight. CoQ10, potassium, vitamin D. Now, I wouldn't necessarily just give a person a whole bunch of potassium. I'd like to measure it and compare it to the sodium, and also look at the trace minerals and see how your cells are functioning. And so, but a lot of us, especially the people that aren't eating enough vegetables, they're probably not getting enough potassium. There's a direct correlation between how much fruit and vegetables you're eating and how much potassium you're getting. And of course, you're getting much more trace minerals if you're eating organic vegetables. Okay. So vitamin D, vitamin C we went over, B complex, fish oil can also just kind of keep the blood a little more lubricated. Flavonoids and vitamin E. And I thought it was interesting, he finds some people need thyroid, and that once they get on the thyroid, they actually lower their blood pressure. Yes?
If you don't do hormone, would you interchange zinc there? Yourself?
Would I put zinc in there as my number 10? Yeah, I think zinc would be good, yeah. I mean, yeah, if you don't need thyroid, I wouldn't take it, just to lower your blood pressure. Probably my favorite go-to product is something called Cartitone, which is a combination of magnesium and B6 and some other botanicals. It does have raw wolfia in it, which is an herb, and it contains a product called reserpine, which has been FDA approved for, decades, since the 40s, I think. It was one of the original products to lower blood pressure. The only problem is it can also reduce serotonin levels. So if you're on antidepressants and you're trying to keep your mood up or your serotonin up, you may not want to use the raw wolfia. But it's very effective, and this particular product I often use for high blood pressure to transition off medication. Excuse me, it also has an anti-arrhythmic effect. And it doesn't, it's not knocking you out. It's not like a huge sedative, but it does relax people. Excuse me. So one thing I started to do was looking at all the different supplements that have been studied and compare them as to how they reduce blood pressure. And I tried to come up with a comparison here. So you can see CoQ10 really stood out as lowering systolic and diastolic. And then comes psyllium husks, which are basically just a fiber. So interestingly, just by increasing your stool volume and you're exercising your gut, you can lower your blood pressure that way. Garlic is also pretty effective at lowering diastolic readings. And cocoa is pretty interesting here. Yeah. Who doesn't like that? And of course, potassium can lower, 3 points on the systolic and maybe 2 points on the diastolic. So I was thinking, how can we get all these in one thing? And all I could come up with was a banana split. So. With garlic and a little psyllium on the top.
Do you recommend whole fresh garlic over astaxanthin type of supplement?
Do I recommend whole garlic? Yes, if your friends don't mind. It's really good. I had one patient who loaded up on his garlic on the weekends, and by Monday you couldn't smell it on him, but he just did it on the weekends. It's kind of funny. He really was into garlic. Oh, there's also something called enhanced external counterpulsation, which is very effective. It's actually a little bit labor intensive, but it's a 35-day program, and they hook you up to these. They're similar to blood pressure cuffs, and they put them around your body, so they actually squeeze your vessels, okay? But what that does is stimulate your body to make more blood vessels in that area, because it's kind of like a tourniquet, okay? And what's incredible is within 35 days, your body says, oh, we got to make more capillaries and blood vessels, and it just goes for it. And by doing that, it creates more space for your blood to flow, which lowers your blood pressure. Okay? Interesting.
Has anybody looked at a hyperbaric chamber?
Has anyone looked at a hyperbaric chamber for this? I'm not aware of that. And you've probably heard of the DASH diet. It's specifically designed to help lower blood pressure. It stands for Dietary Approaches to Stop Hypertension. But it's a very reasonable diet. It's high in fruits, vegetables, low-fat dairy, nuts, seeds, legumes. And what's really great is it doesn't reduce salt. But because you're getting lots of fruits and vegetables, you're getting a lot of those trace minerals again. Okay, you're getting the magnesium and potassium. So in this study, they found they took 133 patients with high blood pressure. After 8 weeks, they dropped 11 points systolic, 5 points diastolic. So now we're talking, really easily, if you combine the vitamin D, lower, manage your blood sugar, get on the DASH diet, couple of supplements, you can get off these medications, I think. And I'm not suggesting that you automatically just drop your medications, because it takes some transition. But at some point, I like to get my patients to a point where they can say, wow, my blood pressure is too low, I need to lower my medication. Because you've treated the cause. So I know it's getting late. I'll just briefly talk about arrhythmias. Blessed are the pacemakers. So what happens with arrhythmias? Basically our hearts are an electrical system. So the pulse rate is actually well defined and well located within a couple of points in the heart itself, which is pretty amazing. You know, these fibers are very specific. They're very sensitive to nerve changes and and electrolyte changes. And both the and also these nodes, they're called, are very sensitive to sympathetic and parasympathetic nerve supply. And I'm sorry. So our sympathetic nervous systems are the fight or flight mechanism. Okay, so if you're out there fighting tigers and bears, and you know, your sympathetic nervous system tells your heart to start pumping fast because we need our muscles to work fast so we can run away or fight these guys. Okay. But also when we're relaxed, we need that nervous system to tell our hearts to slow down. Okay. And for a lot of people, they're not able to do that. Their parasympathetic nervous system doesn't function as efficiently as their sympathetic system. So even though they're relaxed, they're sitting down, they have this perceived stress, perceived tiger or bear, I guess, which keeps their sympathetic nervous system flowing. Okay? So that's something that we want to treat. There's something called proarrhythmia now. And this is a diagnosis based on arrhythmias caused by medication or a side effect of medication. So this is a really common event, and you hear more and more about this. And signs and symptoms, heart palpitations are probably the most common. Sometimes people can't feel the abnormal arrhythmias. And notice that heart palpitations are more of a sensation. There may not be anything there. It could be just a sensation. And for atrial fib, you know, that's one of those things that people get put on anticoagulants because if their blood chambers aren't operating quickly or evenly, their blood can be more stagnant, you know, and just kind of deposit in the different chambers of the heart, create a clot, and that can be a problem. So it's interesting, something called the SA node, the sinoatrial node, is the initial pulse that creates the contraction of the atria. And then that tells the AV node to contract, which helps create the uniformity between the ventricles and the atria. And then that spreads all over the heart, and that causes the very even pulse rate. So sorry to get into physiology, but I thought it was really interesting. The SA node is sometimes called the seat of the soul because, you know, without that little node in there, that pulse never starts. I mean, that begins beating at 3 weeks. At 22 days, as a fetus, that starts beating. Pretty amazing. This is where they're located. The node, the SA node is up here, and then the AV node is more in the center of the heart. And like I say, they're both very sensitive to nerve input. And those are the only parts of the body that are sensitive to both, sympathetic and parasympathetic. So here I want to talk more about dietary influences because there's so many different arrhythmias. I'm not going to be able to cover them all tonight. And I'll mention some of these if any folks here have one, they probably know all about it, and whether it's atrial fib or PVCs or something else, and they can hopefully relate to some of these things. But the food allergies have studied various arrhythmias, and environmental chemicals are also involved here. So another reason to get your food allergies checked, and that can also help your blood pressure, obviously. Caffeine seems to be a bigger issue with arrhythmias. Even low doses, like 1 cup of coffee a day, can cause premature beats, sustained atrial fib, or sustained ventricular tachycardia. In one study, they took 31 people, and they were given 450 to 1,300 milligrams a day of caffeine. I think that's like 5 to 13 cups. And all of them had arrhythmias. I guess that's not saying a whole lot with that much coffee. Nobody drinks that much. Right? Maybe. MSG is another link to arrhythmias, and sometimes it can last for hours, along with aspartame, which is an artificial sweetener. So I would tend to avoid all food additives, coloring. People can be very sensitive to those things, and for some reason it has an affinity to the nervous system, so it can stimulate the sympathetic and parasympathetic again. So I'm going to go through just a few things here. Potassium and magnesium, I think, are probably the most critical things for arrhythmias. And I've had people, again, just by balancing their electrolytes, their arrhythmias go away. And it does make sense because those sensitive tissues within the heart are very sensitive to these elements, and without them, things go haywire. So, fish oil, I haven't mentioned much, but for a study that they did with 65 patients taking 3 grams of oil, so that's about 3 tablespoons of fish oil. There are PVCs and something called, the atrial fib and the PVCs and something called couplets all dropped 47, 68, 72% just with the fish oil. So it could be partially the fish oil, reducing inflammation. Actually, there's a lot of different possibilities there. Yeah.
We were told last week that for men and for women, men should have more EPA,
Yeah, men should have more EPA, women DHA.
and that would hold true in these studies as well.
I think this was a standard blend. I'm not sure if they separated the sexes with that, but I thought those were pretty impressive numbers with not that much fish oil. Yes? Do I recommend fish oil or cod liver oil? I'll recommend both. Cod liver oil, of course, is very high in vitamin A and D. So when you need those things, yeah. And if you're buying cod liver oil, if it actually gives you the measurement for the EPA and DHA, then you're way ahead. You've got A and D and also the, a good amount of the EPA. Selenium, which is commonly deficient in China, has also been linked to a lot of different arrhythmias. So I'll just mention that. My basic protocol is I'll again give L-carnitine, CoQ10, fish oil, and D-ribose. And I often give like a multi-mineral combination, a trace mineral combination. And those, if anyone is really dealing with, serious heart arrhythmias, I can talk to you after the talk tonight, or we can talk more at a visit. I really like Dr. Sinatra. He's really eclectic. He's now into EMFs causing heart disease. Yeah, so he has his patients do earthing, and he has an earthing mat that he puts under everybody's mattress, and it's pretty interesting. Here's a few references. Thanks for coming. I'll answer any questions that you have, and stay as long as you want.